I presented on the relationship between frailty and stroke. Now, frailty is a concept that's very familiar to clinicians that work in the older adult space, but it's actually a concept that's perhaps less familiar to vascular neurologists and people working exclusively in stroke. Frailty is a syndrome where you have a reduced capacity to cope with an external stressor, and that external stressor could be stroke or TIA. So in people living with frailty, they're more likely to have poor outcomes following stroke or TIA. So in the talk, I tried to give an overview of the stroke and frailty space, which is an area where there's lots of exciting research happening at the moment. I had a look at epidemiology, and I presented some preliminary results from a meta-analysis that we are performing looking at the prevalence of frailty and stroke. And what we found from looking at papers from across the globe is that if you take unselected people coming to a stroke unit, about a quarter of them have frailty. And if you look at the condition of pre-frailty, that number goes up much more. And probably the majority of people presenting with stroke have frailty or pre-frailty. So this isn't a niche condition. This is something that is important and we have to be aware of. We had a look at outcomes. Now, frailty by definition is associated with poor outcomes. And what we see for stroke is that any outcome you think of, whether that be mortality, disability, cognitive decline, need for a care home, all of those outcomes are much worse in people living with frailty that have a stroke compared to people with a similar stroke that are robust and have no frailty. So clearly, understanding frailty in stroke tells you something about prognosis and outcomes. Some intriguing papers that I allude to show that frailty may actually have an interaction with acute treatments. So, for example, there are nice data from Cambridge in the UK that show that increasing levels of frailty are associated with a decreasing efficacy of intravenous thrombolysis in acute stroke. And there are also some papers coming out now looking at mechanical thrombectomy and frailty with similar patterns. Increasing levels of frailty seem to be associated with decreasing efficacy of the mechanical thrombectomy intervention. Now, those are observational data rather than randomized controlled trials, but I think there's enough there that I think clinicians need to be mindful of frailty when they're making decisions about treatment. Historically, the stroke community hasn't really been concerned with frailty. And if I'm honest, the frailty community hasn't really been concerned with stroke. But I'm hoping that through some of the papers that I alluded to in my talk today, we're seeing a change there. What I'd like to see is international stroke trialists coming together, collecting frailty in their studies and sharing that so that we get a much better idea of the prevalence of frailty, the associations of frailty, and what that frailty may mean for treatment decisions. And the good news is some of those collaborations are already forming at the moment.